When I was in nursing school, my limited bit of psychiatry and nursing was seeing people at the state hospital eating cigarette butts and watching. And so I didn't see that anybody was having, there wasn't much interest in that direction. Some people had practicums that were in a mental health clinic, which I think perhaps inspired them more. But so I started off as an intensive care nurse. That's where it all started. And I was just drawn to that. I guess when you're young, you're kind of drawn to excitement and all the, I loved it. I loved ICU nursing, and I was in it for about 10 years. And fortunate for me, I was, we were stressed out, ICU nurses, but a psychologist that was working in the hospital used to come into the ICU, and he would help our patients who were going through ICU psychosis. It was fairly common for people who don't get any sleep and are in a lot of pain, and, you know, so many issues would make them, you know, have some issues. So I saw that he was having some nice effects with people, and I thought, I wonder what he's doing. We started asking our head nurse if she would give us some training. Maybe he could come and work with us to have less stress, because we were having a lot of backstabbing and griping and complaining. And it wasn't that we weren't good people, but when you're stressed, you kind of, even if you set out to work on a care plan for someone, we all start sharing like, oh yeah, what he said to me, and oh geez, isn't he horrible to work with? And it's like you get caught up in the problems and the details. So we just needed some help. We were just so stressed out. And lucky enough, this psychologist had gone out to California, had heard a ninth grade welder speak at a conference, which was like, come on, how bizarre is that? I didn't even recognize at the time actually how bizarre that was, that someone with no education was showing up at a conference. And these guys came back. Roger Mills was Clytie's husband, who passed away a few years back now. And Roger Mills and this other psychologist started a institute in Florida called the Advanced Human Studies Institute. And the reason I was the first intern, one of the first year that they did an internship. And the reason that I was drawn to this was because these guys came back, and what they shared with us as ICU nurses was just so, there wasn't anything really, it wasn't like we're teaching the 3 principles. Back then it was really learning, just there was something about it. There's a feeling. That's all they kept speaking to, was this feeling. And we recognized that that was a huge part of helping someone to heal, helping someone to go through anything in an easier fashion. And it was like, so I was just drawn to it, like, wow, this is so cool. I can't believe this is here in my ICU. I'm getting to learn this. And as much as I loved intensive care, I couldn't work intensive care hours and take the internship. It just wasn't going to work. So I ended up taking a job in research, and I was working at the Veterans Hospital at the time. So the research was on stress in the immune system. And we worked with several different categories. We had heavy smokers, we had people having herniorrhaphy surgery, and we had people with diabetes that were in these studies. And we would see these guys every 3 to 6 months. And while I was taking my internship and learning this, I was just sharing little odds and ends that I was learning for myself. And I saw these people changing. Like, I couldn't believe it. People were getting along with their family members that they hadn't. They quit smoking, or they started having a nicer life than they could have imagined. One gentleman had, he had been actually a prisoner at one point because he had been in a robbery and had, not only himself, he got shot as well. So here he is in prison after having been injured with a gunshot wound which paralyzed him. And over the years, while he was in prison, he ended up having amputations done until the point that he was really amputated up to his umbilicus, basically. I mean, and I'd go and visit him on the spinal cord injury unit at the hospital on my lunch hour. And he'd say, Karen, I wouldn't want my legs back for what I know now. And I'd go up and visit him on my lunch hour because I thought, how can he be like this? I mean, even myself, I've learned a lot, but I can't imagine having that kind of an attitude that he had. So I started just seeing how beneficial this was in so many arenas that I knew I had to go into mental health nursing. I wanted to share this on a mental health scale. So that's my internship. It was over a year. It was, we'd meet for Sometimes they had meetings at one of the hospitals. They called it Mental Health 101, I think, Mental Health 102 kind of thing. And Sid Banks would sometimes come, and he would be speaking at the different hospitals in different places in Florida. And I remember one time, I think I told you this, Clytie, I left the meeting that I had a one-on-one session with Roger, and when I got in the elevator, I had to check and make sure my head wasn't hitting the ceiling because I felt like I was, a foot off the ground. Like there was just these unusual feelings that you think, well, where does this come from? And believe me, I was a happy camper when I started learning this. Even though I was a stressed out ICU nurse, I was really a happy person. So it wasn't like I went through a major change where some people did, where they were like super anxious or super depressed. And if I back up just a little bit, when I grew up with, I said my mom was Mary Poppins and my dad was a mortician. So we learned about compassion. We had a lot of death around us all the time, but we also learned to really treasure life, because we saw, like my dad would ask me for a dress for a little girl who didn't have one that was going to be in a coffin. So I learned about being appreciative of life. I had a brother who was mentally handicapped, so I learned compassion. And I would say I had a great life as a child in a sense, but when I was in high school, people used to say, why don't you smile? And I wasn't. When I look back, I wasn't really as happy. I was a good kid. I was very loving and compassionate and all that, but I wasn't happy till I went away to university and people started calling me Smiley. And I got the nickname Mona Lisa because I used to wear my hair straight. You know how you put the big orange juice containers on your head? Started in the middle. And patients used to wake up from surgery and they'd go, Mona, like they thought I was the Mona Lisa. And they give me their wife's brooch, that had, Mona Lisa on it. My dad bought me a t-shirt one time. This is before I moved to Florida. I don't know where he got it. And I don't know, it's just serendipity. It had a picture of Mona Lisa and it said, I'm Mona, fly me to Miami. That was before I moved there. And I don't even know why that happened. So it's just very interesting. But so as I say, I was a happy kind of a camper when I came across this. But what I saw was simple, easy, I want to share this with others, and I decided to take it into mental health. When I finished my internship, and I should back up on my research at the VA hospital, besides working with these different groups of veterans, when I finished that study, I told the doctors that I worked with, I said, I have to leave because I want to share this with the world kind of thing. Anyway, they said, well, we've got a job for you. They had a couple of nursing homes that they were doing training in, and they had me do training in 5 nursing homes, and 5 nursing homes didn't get the training. And so we actually wrote a little research article on that, because the difference in state of mind of people who are working with anyone. So I just kept seeing it everywhere I went. I saw the value of this. When I was teaching the healthcare aides about sharing a nice feeling that maybe some of these people are living in their nursing home and they don't have any family or any friends, that their whole life is basically what you bring to them. So I said, tell them about the weather and your doggy and, what life is like. I mean, you bring life to them, right? And I talked about stuff like, just taking a bath and how enlivening it is, and all these little things, being out in the fresh air and try and get them, to look out a window. And this one gentleman came to the door when I was speaking to all of the staff, and I saw him standing there and he was listening in. And then after I finished my hour and a half, whatever it was, I saw him again. He had gone back to his room and had showered and shaved and gotten himself all cleaned up, because he heard me suggesting that was a nice thing to do for yourself, that you feel better. Mm-hmm. The Hawaiians, and I'll get back to that too, because I moved from Florida to Hawaii to share this as well. But the Hawaiians get in the water in the morning. It's like the ocean to them is their way of kind of revival after their day, or I should say their night. They get up and it's kind of like spiritually bathing them in a sense. And so I can see how so much of what feels good to most of us is, you can see it, right? It's in the feeling. Don't you all feel better when you take a bath or a shower? It's just, there's something about it that wakes you up and livens you up. So we started in the ICU seeing how much our feelings were affecting everybody else. We saw, like I always talk about the fact that the ICU is often like a white tornado. And before I learned this, the white tornado was like this, and then I'd come in like this, and boy, what a day. After I learned this, the white tornado became me coming in and getting into the eye of the storm. How you were able to work in a whole different fashion, and you shared that feeling, and that brought the whole room back into a nicer feeling. I remember one night when I came in, and I don't remember who I was working with that night, but on night shift, there's usually 2 of us, and there's like maybe 3 or 4 that go home from the evening shift. When I came on that night, all the lights were on, all the buzzers were going off. It was like there was so many alarms and lights and action, and we get our report, and it was like the person that I was working with that night was in such a nice, calm feeling like I was. I swear within an hour, all the lights were out and everybody was asleep and everything had calmed down, because you bring something to that, and that's what helps people. And it's like we see this with all of ourselves. We get caught at times. I remember this one nurse going over and she going, calm down, your blood pressure's going up. And it's like, that's certainly not going to help. You can't tell someone, calm down. And so it's like we just started seeing more and more about how this made our life easier. We had a gentleman, he was only in his 40s. He was a lawyer who had open heart surgery. And one of my friends was an infection control nurse. And she says, I've been in the operating room and seen doctors' glasses fall into the wounds. Nothing happens. She goes, nothing happened to this man that he should have such a bad infection. This was a lawyer who was under more stress than probably anybody I've seen. He was one of the most difficult people for us to deal with. And a lot of the staff were scared to work with him because he was taking notes on you. You come into the room and he'd write down what you said, what you did. So everybody's thinking they're going to get sued, and they're like scared to death to work with him. And I just saw past that, and I said, I'll take him. Like we started seeing how to work within what was in front of us. If I came in and I was sick, and excuse me for having a cold today, I sound probably a bit different. But anyway, when you come in, you see that if I was really high energy, I would take the guy with the intra-aortic balloon pump who had 18 IVs and who had, all kinds of things going on. But if I was feeling more on I'm kind of more laid back, I would be the one that would be sitting. And actually, we made this as nurses. We started realizing that people who were dying needed us as much as anyone else, and we would make we divide them up so that we were able to give people that opportunity to spend time with someone in that stage just as much, which isn't easy in an ICU because you're not wanting to put too much time and effort into someone over here when someone over here needs help too. But it's like we started seeing how to divvy it up so that everyone got really well taken care of. And we saw the state of mind of each of us and how that would work with different people that we were working with. My friend Susie and I went to Hawaii one time, came back at 10 o'clock at night, and we started our shift at midnight. So it was a big, this is what you do when you're young, right? You don't sleep much, you do crazy hours. And we went in, and this one gentleman was going to go for open heart surgery the next day. So what happens is at 5 a.m, they come into the ICU, and we'll put in all of their arterial line, their CVP line, their, we're getting all their catheters in, and IVs, everything's set up so that when they go to the operating room, they're ready to go. It also gives them an opportunity to meet us, to see the room they're going to be in when they come back. And we can give them a little bit of, information about exercises. We're going to have you do leg exercises or how to cough with a pillow, things like that. So we sent him off to surgery in such a great state of mind. We're talking to him about the wiki buses, and we're talking to him about the all the funny stuff about Hawaii, like the humu humu nuku nuku apua'a, the little fish with the big name. And anyway, he went off to surgery in such a great state of mind, and we're thinking how wonderful this is. We come back the next night, and we found out he had died on the table. Oh. And it just, for a moment, it just crushes you. Wow. And in the next moment, I thought, yeah, really, how does this 3 principles thing work then? I mean, and it wasn't 3 principles at the time. We didn't call it that. But if I sent him off in that state of mind, then what is this? Isn't that supposed to be the way that things work? And in that moment, I also realized we don't have any power over saving anyone, over the outcome. That's not our job. Our job is to give a feeling to people. He went off to surgery feeling hopeful, happy, that's what I'd want to do. I'd want to go off in that feeling. And so it's like, I realized more and more, to me, Clyde, you know this too, because we used to talk about the feeling a lot. It was all about the feeling. Sid used to say, listen for a feeling. I even wrote a little ditty in my head one time about a song. It was called, excuse me, Listen for a Feeling. And it was because my radio was broken on my car. But it's like, it really truly was. The feeling was what we were wanting to share with people more than anything. And just finishing up a little bit on Florida. I don't know if you guys can see this very much, but this was an article I did for the Florida Nursing News back then. And I drew the cartoons, and it was just talking about state of mind. But I remember the psychologist taking me to hospitals and asking me to write stuff. And it's like, what can I write? I don't know anything. And they talked about the fact that, well, do you know about state of mind? And I thought, yeah, okay, I do. I can write about that. Because if I'm in a good state of mind, my technical skills, my ability to not make errors, my ability to help others in a better fashion, to have, better, just like when I was stressed, I'd go to the back of the ICU to get stuff. And I'd think, what did I come back here for? And it's like, so the state of mind, I could write about that. That was easy. And then I started doing CEUs for nurses, and, started meeting with people like the dean of University of Miami, excuse me. And I remember thinking that, oh, she's like somebody that's like really high up there, right? A PhD meeting with me, for lunch. And while we were having lunch, they were filming Miami Vice as a TV show with Don Johnson. And I saw her and I thought, oh, she's just like me. She was so into watching that and having fun. And you realize we are all the same. I worked with LPNs that I thought were far better than some of the nurses that I worked with. It didn't matter. To me, the feeling is the most important thing that we can share. That's, you talk about the art of nursing or the science of nursing. If you don't have the feeling behind it, all of your technical skills and stuff, just not as beneficial. It's like, it's great to be knowledgeable, but it's the feeling that took us into the profession, and it's the feeling that actually makes us the most, I guess, powerful, or the most helpful, the most healing individual. So lucky enough for me, they called the place that we took our internships the Advanced Human Studies Institute. Pretty clever name, eh? So I have this degree. Mine was in healthcare psychology. I did not have any mental health background whatsoever, other than my little tiny bit in nursing school. But I went off and started a mental health clinic in Hawaii with Chris Heath, who's a social worker from Minnesota. And a lot of people, by the way, were coming down to Florida to train. So I got to meet people from British Columbia, and I'm like, where's that? Because in America, they don't teach you about Canada, so you know nothing about the Great North. So it was kind of like, they have islands up there. It's like Salt Spring Island. I mean, it was just interesting. But people came from everywhere: Oregon, California, Texas, Michigan. I mean, so lucky enough, I guess Sid kind of put a little bug in Chris's ear about starting a clinic in Hawaii. So we went off to Hawaii, and I thought I was going there and going to have a job. Well, little did I know, I was creating the whole place from zero. So when I first went over there, we had to find an office spot. We had to, get the place together, get furniture and painting and all of this stuff happening. It started networking. We'd go up to the state hospital. We'd meet with mental health centers. We were just going everywhere and doing everything. And for the first year, I didn't get a paycheck. The first paycheck I got was $235, and it was about a year after I started there. That people would say that we kind of lived on love in a sense, because we went with a feeling is what we went in with. And I remember I met a young lady who was in the military at the Kaneohe Air Force Base, and she brought over a whole bunch of soldiers to help paint our office for us. And she and I are having so much fun, and the others are like, really? Like, they weren't having as much fun as we were, but it's like you could just see how easy it was for us to get people to help and to join in and to help us with stuff. When we went to the state hospital and the mental health centers, we took on a few patients that were clients that were pro bono. And the mental health center started noticing that we were having some good effects on people. And so, and we saw a few clients from the mainland who came over. So we were like counseling on the beach with people and stuff to begin with. So all of it took time, but the mental health centers told us one time, they said, you guys ought to apply for this contract, this grant that nobody else has applied for. It was a prevention program for youth. And of course, none of us have done prevention. We wrote up our contract, and that was my first major job there. I was working with youth in mostly in the 7th and 8th graders. And if you know anything about working in the school system, the teachers will send you the worst kids. They were not really prevention. And I ended up realizing this after I first met them, maybe a month or so afterwards. They show me their cuts from when they were trying to commit suicide, or they tell me how they'd overdosed and their parents didn't know about it. And so anyway, these prevention kids, I did that for 3 years. I loved it. It was fabulous. And the mental health center used to call us the Sunshine Girls. Nobody expects anyone to come over to Hawaii, try and start a business and make no money at it and still have a lot of fun. So it's like we were Sunshine Girls. Kind of interesting. And after our 3 years of doing prevention, which was just a joy, then they said, well, why don't you apply for this treatment? It was for special ed and emotionally handicapped kids. So we ended up doing that for several years as well. So I worked in the schools and in the prisons and in the psychiatric hospitals and everything with youth. My youngest client was 3, and the oldest client I've had is like 93. So I love that this understanding goes across all ages. And I'll just tell you just for a moment, for the 3-year-old, when I met the family, because the dad was manic depressive, his 7-year-old son was ADHD, and then he has the little 3-year-old. And they came into the office and they just about destroyed my office. Everything, all the toys and the books and everything were all over the place. And so I just said, okay, we're going to divide this one up. So Chris took the dad, Susie took the young boy, and I took the 3-year-old. The 3-year-old had encopresis and enuresis. If you don't know what that is, that means they pee and poop in their pants. And the little 7-year-old, he'd come in and he'd be going, manic depressive. He's just like caught up in all of the words and seeing his dad and all of that stuff going on. And so anyway, we split them all up. And the little girl, you can share something with the 3-year-old, but not a lot in words. I would sit outside with her on the canal. We were on a water, little canal there. And we had something in Hawaii called sleeping grass. Do you know what that is? It's kind of like a Venus flytrap. It closes up and opens. So she would touch the grass and it would close up. And then she could hardly wait for it to open up again so she could close it. But I just spent time with her, just talking story, just having fun, singing songs, taking a walk, whatever. And then one day we're sitting there and she goes, and I knew I finally had her. Like it was like the first time in her life probably that she had slowed down to the, as Joe Bailey calls it, the speed of life. Because she had been so wound up living in a family that was wound up. And what a joy it was to see. As it was funny, I was driving in my car one time and I thought, one day all these people will know who I am, because that's what happens when you work with kids, right? And it was funny because you're driving through town and you go, oh, look, there they are. It was mom, the dad, the little boy and the little girl crossing the street together holding hands. Prior to that, you would have seen him having one running this way and one running that way. So we got to see just how valuable this was with everything, and working with the Hawaii Counseling and Education Center, funding would come and go. And we had all kinds of different programs that we worked with through the years. We had foster parent programming. We had EAP, employee assistance program. We had substance abuse programs. And so funding would come and go. And I would sometimes take jobs outside of the Hawaii Counseling to support my income when funding was low. So I worked at Kahimahala Psychiatric Hospital, where I would do staff education. They would hire just common housewives off the street, or anybody really, to be a healthcare worker in the mental health hospital out there. So it was kind of cool that they had no background except for what I was teaching them about the innate health within people. Mm-hmm. And that was a real treat. I worked at Castle Medical Center on the locked psychiatric wards and with the youth and with different people. And I have to tell you this story. This is It's really amazing. I was just in Hawaii and saw Chris Heath and Michael Neal do a conference down there. And I met this beautiful lady that she knew me and I didn't really know her. She worked at Castle Medical Center when I did. Her name is Debbie Waterman, so she works with Hawaii Counseling now. She says, you didn't know me when I knew who you were. She goes, I was the one who was scheduling all the nurses staff, the shifts. She says, you never said no. You were always willing to take any shift I had. And you worked with the kids when nobody else wanted to. She was just like so surprised by someone like me and how happy I was and whatnot. And I was telling her, I said, there was one time I wrote in a patient's chart that a patient had smiled. And I was told, you can't write that. The insurance companies won't pay for someone if you're saying smile. I'm like, I want to show she's getting better. Well, so Debbie tells me this, and I can't even believe this. She left there about, I don't know, maybe 3 to 5 years now. Her boss, who I then knew as well, before she left, on her evaluation, he told her that her problem was that she was too happy and that they were going to have to work on that, and that the other staff and the patients were uncomfortable with that. Can you imagine that being your problem? So this is basically, and I see it up here in Canada now too, the mental health system does not know what to do with people who are happy. It doesn't compute. And it's a very unusual thing for them to see this. And it doesn't, we had a discussion at the mental health center where I worked. I quit that job in December after about 8 years, I guess I was there. And when we were asking about what mental health is, as you most probably know, mental health to people who work in mental health just means absence of some problem, a disorder of some distress. So they might even think that stress is kind of a mentally healthy person, because that's about as high as they go on this scale. And what I started learning, and we had a lot of charts back in the day when we first started doing this, but there was a point where everything above here was something that I was kind of like intrigued about, because it was words like playful, content, words that were not common in my language either, because most of us had not been as much aware of what's here. We were aware of all this stuff down below. So the mental health system, it's not their fault. They just can't see that there's something way beyond what is in their realm right now, just to actually see. It's not that they don't. I've had many clients ask me, why didn't my psychiatrist tell me this? I said, if they knew, they would have. I said, they honestly, they just don't know, or they would have shared it with you. So it's an interesting place to be in. Judy Sedgman spoke at a conference in Minnesota a couple of years ago about the fact that we keep trying to fit into the mental health system. Mm-hmm. And we really can't, because we're not that. We're not that. We are separate from that. And I realized, wow, that's so true. Like people would say, we're kind of like mindfulness. Well, we kind of like cognitive behavior. We were trying to fit into what they know, rather than saying there's something outside of this box that you're in. And Tom Kelly, I think, he's one of the researchers in Three Principles. He was at that same conference, and he said, he goes, that's true in the literature as well. He says, we're always trying to get into the journals of American psychology or whatever, or, the medical association. And he says, we get all the ones that are more on the spiritual. It's kind of like how it fits for them, that they can take us into that realm, but they can't exactly feel like they can add us into, we're not, I guess we just don't have enough evidence base, and the research has been lacking. We can all admit to that there hasn't been as much. So I think there's going to be a big surge in that. And probably you're doing that with your girls too, Lynn, I would imagine. Yeah. And that's part of what I think we all need to see, is that's something to do more of. So when I was in Hawaii, I absolutely loved everything I was doing. I can't imagine, like I said, I wouldn't leave Hawaii except for a man. And I was lucky enough that I went to a conference in California one time, and I met a Canadian. And so I moved up to Canada. And it was a Sid Banks conference, by the way, in California. So I've been up in Canada now for about 23 years, something like that. And I have been managing group homes for the mentally ill, managing homes with brain injury. I've worked in mental health centers. I've worked with, as a coordinator of caregiver support services. I've done some of my own private practice. And what I love about this is that you can take it anywhere to anybody. It doesn't matter. I do presentations for teachers, or it could be for a bunch of, real estate or bankers. I mean, it doesn't matter who it is. Everyone's got stress and wants more joy. Everyone can relate to having some, problem with relationships, whether it's personal or business. Everyone can relate to, just dealing in, I'd say anxiety has become one of the biggest. I see more and more people with anxiety these years, a lot of young people in their 20s who seem to be far more anxious than when I was growing up. I had friends who didn't know what they wanted to do in school, but I think they weren't nearly as anxious as you see people today who are thinking, I'm not as advanced, I'm not as successful as my friends, or I still don't know what I want to do. And there's a lot of anxiety. And I think technology probably encourages our minds to get busier and for that to happen. But I see a great growth in that area. So there's never going to be an end. Somebody laughed about the fact that they said, how many, well, we have all these coaches, we have all these people going into this, but it's like, there aren't enough, and there never will be enough of all of us to take care of the needs in the world. So don't ever be afraid of that. There's always going to be someone who's going to be needing us out there, well, hopefully someday that will come to an end and we'll be doing something other than that. But there's so much need for help for everybody in the world today. So currently, when I should say my job that I was in the mental health position here for 8 years, I did something called collaborative care. It started out of the UK, and I think it had been up here for about a dozen years. Funding, of course, always is coming and going. It was a fabulous program. I worked with a psychiatrist in a community. So it was like working at two different doctor's offices. So it was almost like they had their own mental health center, myself and the psychiatrist at this mental health center, and the psychiatrist would order the medications and I would do all the counseling. So it was a dream job. And excuse me, I loved helping everyone to just find more joy in their life. And I used to think, and you may have heard people talk about this, we would want people to have an understanding about what the three principles were. It's like, I'd like for you to be able to repeat to me, what are they? What do they mean? And I realized more and more that it wasn't even in understanding or even trying to share it with someone else. More and more of my clients would be saying, I just don't do what I used to do. I don't like to sit and bash my husband over lunch with my friends anymore. Or, I'm just finding myself so much more aware of how much joy it is to be with my child. And I'm not thinking about, I have to do this and go there. And so people just started finding themselves quieting their minds down, having a more enjoyable life. And if all of us just knew more about the fact that we think and that we think too much, it would make a huge difference. And to not take your thoughts so seriously. Judy Sedgman did a program with some PTSD veterans not long ago, and I loved how she said this one gentleman came into the group and he probably had a bit too much to drink, but she said, so he's kind of like, well, who are you telling me, you're just some white broad, you don't know anything about the military or whatever. And she says, she goes, if you'd like to stay, she goes, you're more than welcome and you can leave whenever you want. And I'm just sharing stuff that might be helpful to you or whatever. So he did sit down. And when he got up and left, he says, ma'am, I want to thank you. He goes, I didn't know I thought. And honestly, most of us are walking around not realizing there we are having thoughts, and ones that aren't usually beneficial. How many times we're throwing thoughts into our heads that just aren't, doing any value for us. If any of you guys have been through medical procedures or any kind of, illness and things yourself, you'll recognize, excuse me, as a nurse, I will go and investigate. I will learn as much as I can about something. And I'll spend my time doing that. And then the next day I see myself going back to Google again and I'm coming up with the same info that I got yesterday. And I think, Karen, you've seen enough now. You don't have to, see anymore. And then I can let go of it. And when I worked in ICU, I saw some people didn't want to know anything, even if they were having heart surgery. If I said afterwards, what did you have done? They said, I don't know, something on my heart. And someone else wants to know everything. They want to know all the research, all the statistics, everything. So I would give people what they needed, what they wanted. But I'd also try and help them to see, now that you've got that information, you can just let it be and get into that state of not knowing what the outcome is. Because the outcome could be either way, but why get in our heads about it? Like just the common sense that we share about not letting your head get overwhelmed, allowing this to just rest. You know, when I used to change dressings for people and their wounds were just, you know, like you'd almost have to put a girdle on their chest because their bone was so, it was like butter. It just couldn't be held together by any kind of stitches or wiring or anything. And, you know, I look at this and I think, wow, poor guy, you know, and it's like, I say, you know, every cell in your body is the same as how are you feeling. If you're feeling more up, that's when your cells are going to be feeling like they can fight infection. They're going to be feeling that they can heal. So we talk about state of mind again. And I think as much as we can, if we can go back to that place where we're not in our heads about stuff so much, that's where the magic happens for all of us. It doesn't matter if you're on a date, if your head's overwhelmed, or if you're having surgery and your head's overwhelmed. Honestly, everywhere we go, when this quiets down, our life becomes a much more pleasant experience. And I'm going to probably stop here and see if anybody has any questions, but I found a quote yesterday that I thought was really nice by Maya Angelou, you know, the poet. She says, as a nurse, we have the opportunity to heal the mind, soul, heart, and body of our patients, their families, and ourselves, that they may forget your name, but they'll never forget how you made them feel. And that's the truth, you know. It's like all we have is that, you know. I mean, all the skills and everything else we have, if they don't come with the feeling, it doesn't have the same, you know, the whole, I think, you know, if you're going to be a mother, you know, you can be a mother, or you can be a mother who has feeling. And when I speak to young moms and they'll say, you know, I realized I was just in my head and I was totally missing out, and no wonder my kid is over here having a tantrum. That's what happens when we lose the feeling. We end up seeing the results of that around us too. That the more that we can allow ourselves to share a nice feeling with someone, the more that we're going to see things settle down, no matter what it is that's in front of us. So I just think we've really been blessed. And I think as nurses, I see it as a huge opportunity because you're touching not only the person you're working with, but it's the family that you're, you know, when we had to do our internship, I said we had to do a write up what you're going to use this for if you're going to take this internship. And I remember writing that I wanted it for myself as a person. I wanted it for my husband and or family, if that was going to be happening down the road, and I wanted it for my patients. And it's true. We hit so many people, no matter what profession we're in. You can be just a mom at home who's sharing as much of this and helping as many people. It doesn't mean you have to be in a profession, but it being in a nursing job, you're hitting everybody that's in that room, the doctors, the patients, the other nurses, you know, yourself. You go home, it's your husband, your kids. It's everywhere. So anyway, for the moment, I'll say questions.
Karen, I think we're at an end of our time, maybe just another minute or two. So I think I just want to thank everybody for joining us today, and thank you especially for being with us. It's just delightful to hear about your history, and some of us have had an opportunity to share in that. So we're really grateful for that as well. Well, have a wonderful week, everybody, and we'll be back in 2 weeks.
So, and hopefully we'll see some of you in LA.
Oh, yes. Absolutely. Absolutely. We'll look forward to seeing you then. Bye for now.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye-bye.